So the decision as to who is going to undergo a lung transplant is it's not a simple individual. It's really a community who makes that decision. So this really starts off with the family physician referring the patient to a pulmonary fibrosis specialist. The pulmonary fibrosis specialist will think that this patient would be potentially an appropriate candidate. And many patients who fall within a reasonable age range and don't have a lot of complexity and other illnesses would be appropriate candidates. The pulmonary fibrosis specialist may not refer a patient for lung transplant if they're obviously not a candidate, and obvious things would be individuals who are smokers, individuals who have cancer, individuals who are unmotivated, individuals who are not compliant with therapy, they're not showing up for hospital appointments, they're not following recommended therapies. So those patients would not be appropriate for referral from the fibrosis clinic. If the fibrosis clinic determines that a patient is potentially an acceptable candidate, and in fact they would require a transplant, they would refer the patients on to the transplant clinic. First thing that happens at that point is the patient is met by a lung transplant specialist, a respirologist who has expertise in this, who would make an initial evaluation. And the patient would also meet with the lung transplant nurse coordinator. And the transplant nurse coordinator's job is really to explain what the transplant process is, to answer a lot of questions about the logistics about transplant. Can patients live at home? What are the social obligations? Who could potentially be a caregiver and the like. So really the first session is an education session. Some patients at that point would determine, well, that's not really what I'm interested in pursuing, maybe because they're risk averse, maybe because it's socially challenging for them to spend a period of time in Vancouver, maybe they don't have family support. But many of the patients at that point, if they were thought to be medically potentially appropriate and they were interested in pursuing the transplant option, then they would go on to have an extensive series of investigations to identify other medical conditions which might change the risk profile for that individual patient. So when we're evaluating patients for transplant at the transplant clinic, we're looking at medical issues. So are there medical factors that would increase the risk of transplant to the point that the risk benefit would not be favorable for that individual patient? On the other side, there's the kind of more social issues related to determine whether transplant is the right thing. So does the patient have a support network? Can they get to Vancouver? Can they spend time in Vancouver? Do they have financial resources? And if not, are there other resources that can be brought to bear to help with that individual? Patients also to be seen by a dietitian. Patients who are very overweight or very underweight have a very high risk for transplant, so this is something we can work on and help patients. We anticipate most patients will go through some sort of exercise rehabilitation program, and that's both to try and optimize conditioning for the surgery, but also to allow patients to get a feeling for what it's like being under intensive supervision and working in partnership with the healthcare team. Patient is also evaluated by a psychologist. Many patients may have had a history of some sort of psychological disturbance over the years, which doesn't mean that transplant is not appropriate. It's really to determine how can we work with the patient to overcome obstacles moving forward. So after the patient has met with all these individuals and had the investigations done, we sit down and sort of look at the whole picture with the patient and family and try and identify the risk profile. And if the patient and family are keen to proceed at that point, the next step would be for us to meet with our multidisciplinary team, determine if there are any obstacles that would prevent successful transplant, and if all is good, the patient would then go on to the transplant list. So it's really a combination of the lung transplant team determining transplant is feasible, the pulmonary fibrosis team determining that there are no other treatment alternatives, and the family and caregivers in association with the patient determining that that's the right thing for that individual.